a massive drop in the number of people applying to come to the UK to work in health and social care. And specifically, most specifically, care workers have the number of people applying for those visas has pretty much dropped off a cliff. And I think we need to talk about why, and we need to talk about what that means for our ageing society, for our elderly people, and for the people who are vulnerable and in need of care. Now, over the last few years, the government introduced a very stupid visa system, including sort of separated out visa categories. So everybody who came here to work was not on just one simple visa system that allowed them to work in our economy and to make that contribution. We had different categories for different types of workers in different sectors, and we still have that system. And it means that workers come and they are tied to one specific employer, and it's incredibly difficult to leave that employer. And that's fueled a situation where migrant workers are particularly vulnerable to exploitation and abuse. And there's been real scandals about the rates of exploitation and abuse of migrants who have come to work specifically to care for our elderly and vulnerable populations here in the UK over the last year. Now, last year, you'll remember, there were exceptionally high net immigration figures, and the Conservative government that we had at the time responded with absolute panic, even though they were the ones who had granted every single one of those visas, and they decided to further restrict the rights associated with certain categories of visa. And one of the ones in their firing line was care workers. So what they did was they said care workers will no longer be entitled to travel with their family members, so-called dependents, to the UK. Now, I want to make clear that the dependents that people were entitled to come with them to the UK before was their spouse, their partner, their husband or wife, right? And their children, if their children were under the age of 18. That is the definition of family members, or dependents in this case. It was not broader family than that. And if you ask people to come to the UK to work for 5 years or longer and to care for our vulnerable and elderly population in jobs that are extremely hard work, extremely skilled, and extremely, unfortunately, low paid, then the very least you can do is allow them to live with their children. And when you deny them that right, well, obviously the cost-benefit calculation that they will make is that they can actually find better opportunities elsewhere. And that seems to be what has happened, because we've had numbers of people applying to come on this visa fall off a cliff. And obviously, in some ways, for the government, that's a win, because they promised they were going to bring down immigration figures, and they didn't care, apparently, or they didn't give any indication that they cared how that would impact our communities, because our communities rely on immigration, and most certainly our elderly and vulnerable communities rely on care workers who come to the UK as immigrants. There are still 130,000 vacancies today in the social care sector. So any argument that now that the supply of labour will be more scarce and therefore that should drive up conditions are completely blown out of the water by the fact that even with the high numbers of people coming as immigrants to work in that sector, there was a massive scarcity of available skills and labour. And so according to that argument, the pay and conditions of care workers should have risen already, but it didn't. It didn't for lots of structural reasons, including the fact that the entire sector is drastically underfunded by government cuts to local authorities, and because of the fact that, as I say, the visa conditions are so restrictive that they enable the exploitation and abuse of workers. So those are the ways to improve conditions. If you want to change conditions for care workers, you need to address those structural factors instead of blaming migrants who come here to do that work. And just finally, I want to address the absolute dangers that are guaranteed to be piling up in my comments here, saying, oh, it's not migrant care workers that we have a problem with, it's them illegals. Because I want to tell the story of Brendan Nwabichi. He actually is here on a student visa. He's from Nigeria, but he works in order to support himself and his family, as well as studying, and he works as a care worker. He's one of the many, many migrant care workers that do that work, even though conditions are poor and pay is low. While your mates were out there just expressing their legitimate concerns about the illegals and not at all targeting care workers, well, he came out of a 12-hour shift where he'd been caring for somebody elderly in our community, and he found that his car had been overturned and set alight. So let's be real, guys. These supposed concerns that are supposed to focus just on the wrong kind of immigrant always lead in to hatred and even violence towards other kinds of immigrants. Never think that you are one of the good ones. Never think that the leopards will not eat your face and that you are safe. In fact, this hatred is towards everybody who can be categorized as different, and they can always shift the boundaries of who that is.